Hi, my name is Samantha Broome, and I'm a senior at USC Lancaster, and I am pursuing my Bachelor's of Science in Nursing, or BSN. Today I will be presenting my e-portfolio that was created for my Graduation with Leadership Distinction, or GLD, through the research pathway. My first section is the About Me. At the time this was created, I was a sophomore and just accepted into the BSN program. I have learned and grown so much since then. During my sophomore year, I was involved in student government, student nursing association, and a peer advisor at Lancaster. Most importantly, I was involved in Research Club, which helped me to pursue this GLD. Research Club helped me to find my passion for research and the research process. Pursuing my GLD allowed me to combine this newfound passion to my ultimate goal of becoming a nurse. This is my key insight page that links all of my key insights. My first key insight is finding myself through serving others. The basis of this key insight is the reason I chose to pursue nursing, my passion for service. Virginia Henderson was an influential nurse, researcher, theorist, and author, and she is well known for her definition of nursing, which states, "The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to peaceful death, that he will perform unaided if he had the necessary strength, will, or knowledge." Part of this definition is a promotion of patient's independence. Through research, we can determine health indicators that would hinder a patient's independence, and therefore promoting a patient's overall health. And these are the artifacts for this key insight. My second key insight is a team for one. Here I explain the importance of teamwork. Clara Barton was an influential nurse and the founder of the American Red Cross. Throughout her life, she faced many challenges, and the majority being based on sexism. For example, after Clara Barton established the first public school in New Jersey, she lost control of it because local leaders did not see that it was fit for a woman to be in charge of a public institution. If she did not lose control, how much more could Clara Barton have done to help that community? Each member of a team brings a unique value and should be treated with respect. On a healthcare team and a research team, having many different people that have different perspectives can be imperative to a solution. My final key insight is reducing the risk through documentation. In nursing, charting is a big part of the job. It is one way that everyone on a healthcare team communicates with each other about our patients. If we as nurses are not properly documenting on a patient's status, how will the doctors and other healthcare team members know if treatment is effective? Documentation is also important in research. I was involved in the Student Mobile Anthropometric Research Team, or SMART study, on the USC Lancaster campus. After our first SMART study data collection, I had the task of inputting the data. While going through the files, I often found information missing or that was abnormal. But due to protocols, we had a notebook in which we would document if there was something that could cause the participants' measurements to be irregular, such as if they were wearing jeans or if there was a mistake in the measurement process. The problem arose when the researcher did not document any of these factors. Documentation may seem like a burdensome task, but it helps to reduce the risk of a preventable complication. And this is the notebook that we use to document any outliers in the research process. Finally is my leadership section. In this section, I determined a problem and provided a theoretical solution. I proposed the situation of an upcoming Joint Commission visit, or JCO visit, to my unit in which I was a charge nurse of. My plan was to perform a practice trial of the upcoming JCO visit. This would allow me to determine what on my unit was not up to JCO standards. At the end of the trial, I will have a debriefing with the staff to allow everyone to express how they believe the trial went, and allow the opportunity for me to educate my staff on what needs to be improved. The way the simulation relates to my key insight was as a leader, it is important for me to ensure that my staff is prepared for the JCO visit. For us to be successful and pass the accreditation, everyone on the team must work together. And finally, part of proper protocols is proper documentation. And if you didn't document it, you didn't do it. And this is the conclusion of my e-portfolio. Thank you.